Hello everyone and welcome back to Clinical Cousins YouTube channel. Today we're going to go over premature junctional contractions and junctional escape beats. So first we're going to learn about premature junctional contractions. Now we should note that the junction that we're talking about here is the AV node or the AV nodal junction. It is a junction or a connection between the atria and the ventricles. Now a premature junctional contraction is exactly what it sounds like. It is a early or premature unwanted contraction that is fired from the AV nodal junction. The rate of this rhythm, it can be variable. It depends on the underlying rhythm that's already there, but it's usually about 60 to 100 beats per minute. The rhythm is regularly irregular, meaning that we can regularly predict when these PJCs will occur. Now, if a P wave is going to occur, it will likely appear as an inverted wave. Remember that depolarization currents are positive. So if we have a positive vector that is headed away from our positive lead, this is going to result in a negative deflection. Therefore, the PR interval does not really indicate a true progression of electrical events like we see in normal sinus rhythm. And there's no reliable P to QRS ratio. The QRS complex is between 0.06 and 0.11 seconds. There are usually no groups and there are no dropped complexes. So basically, what do we need to know about premature junctional contractions? Simply put, the AV node may act as a temporary pacemaker. There can occasionally be groupings or groups of these PJCs back to back to back. And there may even be some inverted P waves. Now, let's talk about a junctional escape beat rhythm. So it is exactly what it sounds like. It is the AV nodal junction which is providing us an escape from not having a heartbeat at all. Basically, we are escaping what would otherwise be death by using our AV node as a temporary pacemaker. So the rate of this rhythm really depends on the natural underlying rate, and the rhythm is regularly irregular, meaning that we can predict when this abnormal beat, this junctional escape beat, will occur. And how do we predict this? Well, this is because it'll happen after a long pause when the SA node has not fired, and we'll see why in just a second. So these P waves, remember, they can be either absent or they can be inverted because they can travel away from our positive electrode, and there's no reliable PR interval or P to QRS ratio because they don't actually indicate the correct series of electrical events in the heart. So the QRS ratio is going to be between 0.06 and 0.11 seconds. There are no groupings and there are no dropped beats. In fact, there are no dropped beats because we have a junctional escape beat. Basically, what is occurring here is that our SI node, he fails to fire. The only difference between this rhythm and sinus pause or sinus block that we talked about earlier is that instead of the SA node picking up the slack, the AV node picks up the slack and fires an impulse to save the day. The actual escape beat is located after the long pause. Basically, if the SA node fails to fire a beat, the next fastest pacemaker, which is the AV node, will reach that phase 4 depolarization that we talked about, and it'll initiate a firing of an action potential, which will result in a junctional escape beat. As always, thank you for taking the time to learn with us today, and remember to like and subscribe for more content.